All right, we got a step one question here. 45-year-old man, chronic hepatitis C, newly diagnosed HIV in a clinical trial. And despite the dosing, the patient shows signs of cognitive decline, and the MRI reveals cerebral white matter hyperintensities. The viral RNA levels are undetectable in the serum but remain elevated in the spinal fluid. Agent Y is capable of being transported out of the central nervous system, limiting its effectiveness. 6 weeks later, okay, so then they're going to go and administer second compound Z with the goal of improving the CNS levels. And what they find is that they give compound Z and no changes are seen in the hepatic and renal function tests. So what explains the improved penetration of Y with the co-administration of Z? So A, increased permeability of the granulations. B, induction of the cytochrome P450 enzymes in the liver. C, inhibition of the renal tubular drug excretion. And D, inhibition of the P-glycoprotein at the blood-brain barrier. And E, increased metabolism of agent Y. Okay, so this is a pretty difficult question. So increased permeability of the arachnoid granulations. The arachnoid granulations, these structures reabsorb CSF and they don't allow drug entry into the CNS. And so that's not going to be our answer. Basically what's happening here is we have to know that P-glycoprotein is a drug efflux pump at the blood-brain barrier that limits CNS drug penetration. Basically is like, hey, you shouldn't belong here. I'm going to P-glycoprotein you out of here. And if you inhibit the P-glycoprotein pump, the efflux pump, then it'll increase the drug levels in the brain without changing the serum levels. And so the serum levels would change if you did induction of cytochrome P450, for instance, right? Because that would increase the drug metabolism, reducing the drug levels and changing the serum. And the question said it didn't change the serum, so it can be B. Inhibition of the renal tubular drug excretion. So that could raise the drug levels, but that didn't happen, and so it wouldn't explain the CNS, right? So that can't be our answer. And increased metabolism to a more lipophilic compound. That would help CNS entry, but it wouldn't change the serum levels. And so the metabolism tends to reduce the drug activity. So that would not make sense. You wouldn't increase the metabolism of it. That would reduce the drug activity. And so yeah, no change was seen in these levels. And so the metabolism wouldn't be the issue. So E and B are kind of getting at similar things. Instead, the P-glycoprotein is just going to throw it out. And if you inhibit that, then you're going to keep it in the CNS, and that allows for more proliferation. So yeah, that's the bottom line. PGP, P-glycoprotein, is an ATP-dependent efflux transporter on the luminal membrane of the capillary endothelial cells of the brain. It effectively pumps the drugs back in the blood. It's like, get out of here. We don't want you in the brain. And so drugs like antivirals that are normally excluded from the BBB now can accumulate in the CSF if you inhibit it. So that's the mechanism for this. Hopefully it was helpful. If it was, you know what to do. And we'll see you in the next video.